Hello, my name is Dr. Achmed Kamara, Clinical Director of Doctor2U and the UK National Health Service NHS GP, sharing useful medical knowledge with you so that you can become a masters of your own health. It is important to remember that nothing shared here is a direction on how to manage your particular health condition. You need to always seek expert medical advice for your personal circumstance. Today, I want to talk to you about prostate cancer. Now, first of all, it's important to know what the prostate gland is. Now, the prostate gland only exists in men, and therefore, prostate cancer is a cancer that only occurs in men. The prostate gland is a gland that sits at the bottom of the bladder around the tube called the urethra that takes urine out of the bladder into the outside world. The main job of the prostate gland is to make semen. This is a liquid that carries sperm. But sometimes the cells of the prostate gland can grow in an unregulated fashion, in an abnormal manner, that can lead to prostate cancer. Prostate cancer is the most commonly diagnosed cancer in men within the developed world, including the United Kingdom. It is estimated that in our lifetime, about 1 in 8 men will develop prostate cancer. In the United Kingdom alone, every single year, over 47,000 men are diagnosed with prostate cancer. And rather staggeringly, about every 45 minutes, a man dies from prostate cancer. What are the risk factors for prostate cancer? Well, actually, age is the biggest risk factor. Most men who develop prostate cancer are 50 years or above. It can occur in younger men, especially if they're at particularly high risk. For example, if you have a close relative who's developed prostate cancer in the past, for example, your father, your brother, or a paternal uncle, that can actually increase your risk of developing prostate cancer in the future. We also know that Afro-Caribbean men are much more likely to develop prostate cancer, for example, than Caucasian men. And the sort of lowest risk groups amongst men tend to be men from Asian backgrounds. Afro-Caribbean men also tend to present with more advanced prostate cancer that is usually a little bit more difficult to manage. So how do you know whether you've got symptoms of prostate cancer? Well, in a lot of cases, men don't actually have any symptoms, and this can be worrying, and the disease is diagnosed through a screening blood test, for example. There isn't a formal screening for prostate cancer in the United Kingdom, but a blood test can be organized through your general practitioner or physician following a discussion of the pros and cons. When symptoms do develop, they may include difficulty to start urination, getting up multiple times at night to pass urine, or a feeling of incompletely emptying your bladder. Now, some men may also develop a very poor stream to the urine. So we normally say no longer being able to hit the back of the pan with your stream. There are some additional worrying symptoms that includes passing blood in the urine, or some men may also develop bone pain. Now, a lot of those urinary symptoms that I mentioned do not only occur with prostate cancer. They can also, and in fact more often, occur as a result of a benign enlargement of the prostate. So in all men, the prostate starts as a small size and increases with age. And as that increase happens, it squeezes the tube that empties the bladder and takes urine into the outside world. And so naturally, you have this process called benign prostatic enlargement, which can cause all of these urinary symptoms. So just because you have these symptoms does not necessarily mean you have prostate cancer. It is important, however, to be aware of them so that you can seek medical advice and appropriate tests can be done to determine what the cause in your case is for your symptoms. So other common causes of those symptoms include a urinary tract infection, or some men can actually develop an infection of the prostate gland itself called prostatitis. And so there are multiple causes of these symptoms. It is important to seek advice to determine what the cause is in your case. So what are some of the tests that can be done when you present to your general practitioner? Well, depending on your symptoms, your general practitioner or your physician may decide in the first instance to do a urine sample analysis, and that can tell whether or not there is an infection, whether or not there is any blood that's not visible to the naked eye, and may send that sample also to the laboratory to see if they can culture bacteria or if they can determine the existence of blood under the microscope. Your physician may also decide that it's important to examine your prostate, and this can give additional clues in terms of the integrity or the regularity of the prostate gland, and therefore whether there may be any prostate cancer. Additionally, it may also be useful to do a blood test called PSA. This is prostate specific antigen. This is a chemical produced by the prostate gland. Now, it can be raised in this benign prostatic enlargement process. It can also be raised during an infection of the prostate gland, prostatitis, or a urinary tract infection. But significantly, it can also be raised because of prostate cancer. So your physician, your GP, will be able to tease out what is the likely cause of a raised PSA if that was found to be the case when they do your blood test. Now, if after those initial tests it's determined that you are likely to have prostate cancer or you're at high risk of developing prostate cancer, you may then be referred onwards for specialist tests which are done in hospital, and this can include an ultrasound scan of the prostate gland, a biopsy which is taking a sample of the prostate gland, and an MRI scan or CT scan. Now these are detailed scans that are three-dimensional scans that can give us a little bit more information about the prostate gland, but also about whether there is any disease, any prostate cancer beyond the prostate gland, for example, in the bones. And this is really important in terms of determining what the best treatment option might be for you. Now, assuming you've been diagnosed with prostate cancer, what are the treatment options? Well, it is really, really important to say that the prognosis in prostate cancer, especially when it's diagnosed very early, is really, really good. Most men live with their prostate cancer, and most men with prostate cancer tend to die of other causes, not because of their prostate cancer. So that's really, really important to bear in mind. Having said that, the actual treatment depends on the extent of the prostate cancer when it is diagnosed, whether it is a very aggressive form of prostate cancer, and the options may include an active surveillance. So this is where you have no surgery or radiotherapy if you have what is determined to be low-grade prostate cancer, and a plan of action is put in place where your doctor monitors your PSA, your prostate-specific antigen blood test periodically, and you also report symptoms. In some cases, it may be determined by yourself and your specialist that surgery is the right way forward, and this is usually to remove the prostate gland. In other cases, radiotherapy may be a more suitable option. But whatever decision is made, this will be discussed with you. You will be in a significant part of that decision process. You will weigh the pros and cons and determine what is the best treatment option together with your specialist team. So how can you help yourself? Well, the whole process of doing this short video is to educate you about the symptoms of prostate cancer by being aware of the symptoms, by being aware of the risk factors. Hopefully, you will present earlier to your GP or physician if you have any symptoms, because if diagnosed early, 90% of men with prostate cancer can live beyond 5 years. However, if you present late or you present with an advanced form of prostate cancer, 70% of men will die, unfortunately, within 5 years. So it is important to know yourself, to know what's your normal urinary pattern, and when there is a change, to seek advice early. But not to panic, because as I mentioned earlier, many of the symptoms are also caused by multiple benign conditions or non-cancerous conditions. But the importance is to have the awareness to seek advice early. Well, my friends, that's all for today. Thank you very much for watching to the end, and I hope you've enjoyed this discussion on prostate cancer, and I hope you have a greater awareness about the symptoms and about what to do. The important thing is seeking appropriate advice early. Remember, none of this is an actual advice for your particular situation. If you have any symptoms of concern or you just want to discuss your risk with someone, speak to your GP or physician. And certainly if you want to reach out to us at Dr. To You, you're very welcome to. You can contact us on www.drtoyou, that's drtoyou.co.uk, or follow any of the information with our contact details on the screen. We'll be more than happy to speak to you. I wish you all the best in your journey to becoming masters of your own health.